Hi everyone, myself Pratna Lokhanwala studying in Maliba Pharmacy College is here to discuss about immunoglobulins. Now what are immunoglobulins? Immunoglobulins are basically glycoprotein molecules produced by the plasma cells. They act as a critical part of immune response. Human immunoglobulin is made from human blood plasma. It contains antibodies against many viruses. Human immunoglobulin therapy was first occurred in the 1930s, discovered by Gerald Edelman and Rodney Porter. Immunoglobulin therapy is the use of a mixture of antibodies, that is normal human immunoglobulin, to treat a number of health conditions. Depending on the formulation, it can be given by injection into the muscle, a vein, or under the skin. Now that is intramuscular, intravenous and subcutaneous. The effects last a few weeks. Immunoglobulin is a sterile solution of concentrated antibodies extracted from healthy donors which provide passive immunity. Now, basically, immunoglobulins are classified into five different types on the basis of the antigen present in the patient. First, cytomegalovirus immunoglobulin, then hepatitis B immunoglobulin, human normal immunoglobulin, tetanus immunoglobulin, and histoimmunoglobulin. First is cytomegalovirus immunoglobulin. This medication is used to prevent a certain serious viral infection caused by cytomegalovirus in person having an organ transplant, mainly transplant of kidney, heart, liver, lung, pancreas. Indication: it is used in acute cytomegalovirus infections, cytomegalovirus prophylaxis in AIDS and transplants, and congenital cytomegalovirus. Its mechanism of action: the globulin contain high concentration of antibodies directed against cytomegalovirus. In case of person who may be exposed to cytomegalovirus, it can raise the relevant antibodies to the levels sufficient to attenuate or reduce the incidence of serious cytomegalovirus disease. Now it means that if I am the person suffering from cytomegalovirus infection, then cytomegalovirus immunoglobulin will increases the production of antibodies in my body, which will attenuate, that means, or reduce the incidence of the serious cytomegalovirus disease. Its interaction is with live viral vaccines. Antibodies present in immunoglobulin may interfere with immune response to live viral vaccines. Therefore, they should be administered after 3 months. Its adverse effects are flushing. Now, what is flushing? Flushing is involuntary response to nervous system leading to widening of the capillaries of the involved skin. Nausea, arthralgia. Arthralgia is the pain in joints. Fever with chills, aseptic meningitis, muscle cramp, and anaphylaxis. Dosing: during renal, liver, pancreas, heart or lung transplant, 150 mg per kg intravenous infusion within 72 hours of the transplant. Then after, 150 mg per kg after 2, 4, 6, 8 weeks post transplant, and 100 mg per kg after 12 and 16 weeks post transplant. Now, during acute cytomegalovirus infection, 200 mg per kg intravenous infusion on days 1 and 7, given with proper antiviral therapy. Now next is hepatitis B immunoglobulin. Hepatitis B immunoglobulin is a solvent detergent treated sterile solution of purified gamma globulin, that is IgG, fraction of human plasma containing antibodies of hepatitis B surface antigen. It provides passive immunization for individuals exposed to the hepatitis B virus and reduces infection rate of hepatitis B. Now its indication: Newborn bonds to the mother with serum HbS-Ag positive. Now, what is HbS-Ag positive? HbS-Ag positive is a test which determines the presence of antibodies present in the patient. If the test is positive, there is the presence of hepatitis B antibodies, and if the test is negative, the person is not infected with hepatitis B. Next is newborns whose mother had hepatitis B during pregnancy, children following exposure to hepatitis B, prevention of recurrence following liver transplantation. Adverse effect: fever with chills, nausea and vomiting, allergic reactions, arthralgia, moderate and low pain, and pain at injection sites. Now its contraindication: anaphylactic or severe reaction when administered parenterally to the patient with IgA deficiency. Now what is the role of IgA? First we'll understand that. IgA protects against the infections through mucosal membrane lining mouth, airways and digestive tract. Now if a person is IgA deficient, then there will be chance of infections more. Now its dosing. Available as 312 international unit per ml. Newborns to mother with serum HbS-Ag positive 0.5 ml intramuscular less than 12 hours after birth, simultaneous with hepatitis B administration in the opposite arm. It means that in one end there will be hepatitis B immunoglobulin injection, and simultaneously in the other hand, that is the opposite hand, there will be an injection of hepatitis B toxin. Repeat after 3 months, and if there is delay, then repeat after 3 and 6 months. Now post exposure prophylaxis. 0.05 ml per kg in less than 12 months and 0.06 ml per kg for more than 12 months given intramuscular. Hepatitis B immunoglobulin is given within 14 days after sexual intercourse and within 24 hours after needle stick or mucosal exposure. Prevention of recurrence following liver transplantation: 20,000 international unit intravenously once with grafting of transplanted liver, and then repeat every after 7 days and every 2 weekly from week 2 to 12. From 4 months onwards, give monthly, maintaining antibody levels to HbS hepatitis B greater than 500. It means that if I am the one whose liver is transplanted, I am getting 20,000 international unit intravenously during grafting of liver, and that is repeated for 7 days. And from next onwards, from next week, that is second week to the 12th week, I am given 2 injections weekly. And from 4 months, I am given a injection a month to maintain the hepatitis B antibody level greater than 500. Next is human normal immunoglobulin. Human normal immunoglobulin is a solvent detergent treated sterile solution, same as hepatitis B immunoglobulin for intramuscular administration and contains no preservatives. It is prepared by cold fractionation from human plasma. Indications: that is, it is used during measles infections, hepatitis A infection, varicella zoster infection, rubella virus infection, A gamma globulinemia infection, poliomyelitis. Adverse effect: local pain and tenderness, angioedema, urticaria, that is hives, and that is mainly rashes on the skin, anaphylactic reactions. Contraindications: in immunoglobulin A deficiency, severe thrombocytopenia, any coagulation disorder. Now its dosing. Available as 16.5% protein per ml. Risk during traveling: less than 1 month to stay, 0.1 ml per kg intramuscular. If I am going to stay for longer, then I have to repeat the dose every 2 months. Post-exposure prophylaxis: hepatitis If I am suffering from hepatitis A, then 0.1 ml per kg intramuscular with 14 days. Within 14 days, if I am suffering from measles, then 0.25 ml per kg per dose within 6 days. And if I am suffering from varicella zoster virus, then 0.6 ml to 1.2 ml per kg within 72 hours. Next is tetanus immunoglobulin. Its mechanism of action. It is a human serum preparation containing antibodies against tetanus. The gamma globulins protects against tetanus infections. It is given for prevention and for active immunization along with tetanus toxin. Now its indication. It gives passive transient protection against tetanus when a patient personal history of immunization with tetanus toxoid is unknown. Patient received less than 2 prior doses of tetanus toxoid or received 2 prior doses but delayed of more than 24 hours between the injury time and initiation of tetanus prophylaxis. Next is adverse effect at hives, angioedema, nephrotic syndrome, local inflammation, pain, tenderness, muscle stiffness at the site of infection, fever, and lethargy. Its contraindication are hypersensitivity to human antibody, thiomersal, or any components circulating anti-IgA antibodies. Now dosing. Advisable to administer 250 units regardless of size of child, but intramuscular dose is calculated on the basis of body weight. Standard is 4 units per kg. Its interaction. To avoid inactivating of live vaccines containing live viruses or bacteria, give vaccines 2 to 4 weeks before or 12 weeks after tetanus immunoglobulin. Now last is histoglobulin. Histoglobulin is lyophilized preparation of histamine coupled with human normal immunoglobulin. It is administered subcutaneously, induces production of antibody against histamine immunoglobulin complex which binds and inactivates histamine release during allergy. So what it basically does, it binds with human normal immunoglobulin and it produces antibodies against histamine immunoglobulin and forms a complex which binds and inactivates histamine. Repeated doses histoglobulin increases this antibody titer, for which booster doses of histoglobulin are administered every 6 months. Its contraindication is hypersensitivity to histoglobulin is a contraindication. Now quiz. During liver transplant, which of the following should be used as prophylaxis? A. Histoglobulin. B. Hepatitis B immunoglobulin. C. Human normal immunoglobulin. And D is tetanus immunoglobulin. Now we know during liver transplant there are most chances of getting hepatitis B infection. So it will be hepatitis B immunoglobulin. Next is during infections due to varicella zoster virus, which is most suitable. During infection due to varicella zoster virus, human normal immunoglobulin A, B, tetanus immunoglobulin, histoimmunoglobulin, and hepatitis B immunoglobulin. So the answer is human normal immunoglobulin. Who discovered the structure of immunoglobulin by treating it with beta-mercaptoethanol? A is Nisonov, B is Edelman, C is Potter, and D is Whittaker. And the answer is Edelman during 1930s. Immunoglobulin are produced from which cells? We know it is produced from plasma cells, but which cells? A is RBC, B is WBC, C is lymphocytes, and D is macrophages. And answer is white blood cells. If a person is suffering from injury and his body weight is 80 kg, what will be the dose of tetanus immunoglobulin? Now we know that the tetanus immunoglobulin is determined on the body weight. So if the person weight is 80, we know the standard is 4 units per kg. So 4 into 80, that will be 320 units. Thank you.